thank you for staying with us for Newsmaker Live for this Wednesday. We really appreciate you having us discussing health issues for the entire 90-minute period. And we talked about renal failure earlier on. Now we're talking about the Behavior Risk Factor Survey. And joining us at this time is Nurse Juliet Joseph. She is the Assistant Principal Nursing Officer. And of course, Dr. Gemma Cherry. And Dr. Cherry is the Deputy Epidemiologist. She's also the BRFS Data Collection Coordinator. And BRFS, as I said before, Behavior Risk Factor Survey. And welcome, first of all, to the program, ladies. It's very nice to have you.
Thank you.
Had gentlemen, and now I have ladies, so I guess we'll have a little bit of fun here. But you have for a very important purpose. You have that Behavior Risk Factor Survey coming up. You have some time frames in which you're going to have it. First, let's talk about the survey. What is the Behavior Risk Factor Survey all about?
Okay, the Ministry of Health, in conjunction with the Pan American Health Organization and also the WHO, would be undertaking a behavioral risk factor survey. Now, the reason why we're doing this behavioral risk factor survey is basically to improve and to strengthen our surveillance as it pertains to chronic non-communicable diseases. And you would well appreciate why we would want to undertake this survey, having had Nurse Dupree and Mr. Prosper earlier as your guests. They spoke quite a bit about the connection that exists between hypertension and diabetes as it relates to renal failure. And so the ministry is basically doing this to improve our surveillance for chronic non-communicable diseases. If we have baseline data, what that would allow us basically to implement programs, policies at both the local, the primary and what we call the secondary level, in order to help us put measures in place to actually eliminate most of these risk factors. As you know, a lot of it has to do with behavior, so we would be better able to deal with these risk factors, and hence the importance of the behavioral risk factor survey to us at this point.
Now, what do we have right now, the system that's in place? What obtains? How familiar, how knowledgeable are we about non-communicable diseases in our local context? And I know that there has been a focus of late, but what really do we know?
Okay, we know that chronic non-communicable diseases are the leading causes of death, not only in St. Lucia, but globally. And to date, there are about 60%, in fact 60% of our deaths are chronic non-communicable diseases. And it is estimated by WHO that it will rise to about 73% by 2020. Chronic non-communicable diseases can be prevented because there are various risk factors which we can just by modifying our lifestyles, we can prevent. And some of these risk factors are obesity, alcohol abuse, tobacco use, inactivity, and poor nutritional diets. So if we can identify in our population the existing risk factors during our survey, then as Nurse Cherry said, we can plan programs and we can develop interventions that would prevent us from having that high rate of chronic non-communicable diseases.
Now, I'll throw this one at you. We are a party country, quote unquote. I mean, we find a reason to fet anytime. And we're talking about, you know, the drinking, we're talking about the diet and stuff, and that is all part of our party culture. You have food and you have drinks. Aren't we swimming against the tide, trying to have people curb their appetites, cut down on the drinking, you know, to protect their health when all we want to do is eat and drink and have a good time?
Well, that is why we said, Mr. Reynolds, that people have to understand that a lot of the risk factors that exist in our population, we can prevent chronic non-communicable disease. It's not because we have risk factors that everybody must come down with a chronic non-communicable disease. It's a behavior change that will make the difference. So people in our population must realize that yes, the rum is there, the eating, the drinking, fast foods are there, they will always be there, but they are slowly killing us. And we have to come to that place where we have to change our mindset, realize that healthy eating, physical activity, in fact, less alcohol abuse or consumption, and I would say no smoking would really help us in St. Lucia to prevent the chronic non-communicable diseases that are really slowly killing us and really killing our nation.
Well, you said slowly killing us for well, twice in one sentence. But then when you talk about, you know, it is the leading cause of death, they are the leading cause of death, and the World Health Organization is estimating or predicting that it will be up to 73% in 2020. I mean, I don't see any slowness in the death rate there. I mean, we're just killing ourselves quicker and quicker. I mean, Dr. Cherry, what do you say about that?
Well, basically, like Nurse Joseph was saying, and I mean, you would appreciate in the discussions earlier that yes, the predictions have been made by the World Health Organization, and if we are able to curb, right, our behaviors, if we could make these lifestyle changes, because most of them are just lifestyle practices, and if we are able to at least sit back and say, well, okay, look, this is affecting me, and take for example cigarette smoke. Cigarette smoke does not just affect you would appreciate the effects of secondhand smoke. So at the end of the day, it is not like always you, but you always have to think of other persons also. And yes, it's true that they say 73%, and I think you saying that you don't think it is something that is killing us slowly. But I mean, yes, it is. And chronic non-communicable diseases, I mean, it's not just one day you get up and you say, okay, or the doctor says to you, you have a chronic non-communicable diseases. It's actually over a period of time, and it is basically as a result of your practices over a period of time that you actually become diagnosed, or you find out that you actually have this disease.
What message do you want to give to the public in terms of paying attention, being aware of their health, you know, that these chronic non-communicable diseases are a real thing, they're a real threat to our lives, to our society, and something needs to be done about them?
We need our public to know that without a healthy nation, we would not have a wealthy nation. And we all of us have potentials. We can be very productive. We all want a quality of life that would be satisfied with. With chronic non-communicable diseases, especially as our friends before said, uncontrolled, it can cause it can have so much impact on our population, with loss of productivity, premature death. We're looking at the adverse economic effects on not only the family, but the community and our budget as well. So it does affect all of us. And we are saying that through our lifestyle change, our lifestyle, we can prevent chronic non-communicable diseases. So I want our public to know that there is hope. But it depends on each of us to bring about that change in our society. We can prevent chronic non-communicable diseases, but it depends on you, Mr. Reynolds, and on me, and on Dr. Sherry, and on the public at large. Just by the way we practice, we do not exercise, we eat anything, fast foods, our diet has very little fruits and vegetables, we smoke to our heart's content, we abuse alcohol. these things will, as I said, you do not want to, you do not want me to say that
kill us slowly.
but they will kill us in the long run, because they will increase the risk of mortality and morbidity as well.
Wow. Very, very heavy stuff there, ladies. I mean, and things to ponder on, and I hope that our audience, our viewers, are listening carefully to what you're saying in order to arrive at a lifestyle change as we move forward. Let's take a break now. When we come back, we'll talk about, you know, whether you're really getting through to the population with your message. Stay with us. Newsmaker Live will continue right after this, and we'll also be taking your calls.